Hey, everybody. Welcome to the TEConnect podcast. I'm John Martin.
And I'm Dean Reverman.
Dean, everything's yucky these days, right?
It is kind of, yucky,
Yeah.
gummy, yucky, right?
We don't want to touch anything anymore, right? It's just
No.
we just don't want to ever touch again, right?
Right.
So obviously, the past year has brought on a lot of concerns about the things we touch and infections and how COVID and other germs can spread.
Right. I think everybody has a new appreciation for just that, just what you proposed right there.
I think so. And while I don't think we're all, scrubbing down our fruit every time we come home from the store anymore, like maybe we might have at the beginning because we just didn't know what we were supposed to do, it's still a going concern. And I think especially in the world of healthcare. So that's kind of what we're going to touch on as our key focus today. We're going to talk about infection prevention technology. We've got two great guests. We have Robyn Ewers from Seal Shield with us, as well as Matt Jordan. You probably remember him from some past podcasts from BlueStar. We're going to talk a little bit about kind of how Seal Shield has approached the infection prevention world and what's changed for them in the last year. We're going to talk about all those high-touch devices and surfaces. Where do we need to be concerned about this? How standard cleaning versus medical grade goes. And we're going to talk maybe about some other places that this kind of technology can be useful. It's not just for healthcare. It's very important in healthcare, but not just there. So all that, as well as our usual VAR value and what's TEConnecting with us. It's time to plug in and get connected.
Welcome to the TEConnect podcast. It's time to get connected.
All right, as I mentioned, we have two fantastic guests on the show today. First up, Robyn Ewers. Robyn is the VP of Business Development for Seal Shield. Robyn, thank you for being on the show. Why don't you take a quick moment to tell us a little bit about Seal Shield, for one thing, what your company does, and maybe a little bit about your background and how you got to where you are.
Sure, thanks. Pleasure to be here today. Seal Shield, what do? We are an infection prevention technology company. So infection prevention is a household term these days, but it wasn't always. And what we build is technology that really mitigates pathogens on surfaces built for healthcare environments, as you said, applicable in every vertical under the sun now, right? We have three main product lines. The first is our antimicrobial waterproof keyboards and mice that all can be disinfected and even put in the dishwasher. I mean, that really drives home the waterproofness of them and the ability to clean them. We have custom cut screen protectors that are not your everyday screen protector. They have our antimicrobial additive in them, so we're preventing pathogens from reproducing on the surface. As our keyboards have that as well. We're also protecting them from different variants of UV light, which can degrade our products. And then I'd say the third bucket is our electroclave solution, which is UV disinfection for mobile devices and handheld electronics. And we've been around for 14 years, and we've been in the game for a long time. And I'm excited to be talking about infection control today because I walked into Seal Shield 8-9 years ago thinking hand sanitizer was enough. And today I have very different, passionate beliefs. I'm lucky to be part of this company and part of our initiative. And, we think we're making the world a little bit of a better place, one sale at a time.
Yeah, what a timely technology. No doubt about it.
Yes, very much so.
Yeah. I think my CEO was joking the other day and he said we're a 14-year overnight success story.
Definitely. Well, our other guest with us today is BlueStar's own Matt Jordan. This is Matt's third appearance on the show. He's trying to run for the record with James Cordy for most appearances. They'll get neck and neck here soon. But he is the healthcare business development manager here at BlueStar. He brought Seal Shield to us. He has actually been kind of championing us to do an episode about infection prevention for most of the last year. It's been on our to-do list for some time now, and thankfully he was able to bring someone to talk about it. So Matt, welcome back. Thanks for being back here. What have you been up to the last few months or so?
Thanks to you, John and Dean. Of course, third time's a charm. This is fantastic. So there's going to be a lot more. There's a lot of good content coming soon for additional podcasts. So hopefully, can be part of the mix here very soon as we move along this year. But really, where I sit, it's a fantastic position, just being the healthcare lead here at BlueStar, just encompassing a lot of different software partners, vendors, technologies, and trying to make sense of it all, vet it out, figure out what's working, maybe what's not working. And then really what's paramount at the moment. And of course, Robyn knows this, it had relationships and partnerships with Seal Shield for many years. So I should mention that they're one of our newer, newly signed vendors. And so the timing couldn't have been perfect, and just a fantastic company and partner to work with. So folks have been beating the drum, if you will, for infection prevention, infection control for many years. And I think admittingly, and Robyn probably feels the same, it's a priority at most. And so as the pandemic hit, as greater concerns for a global concern, folks are panicking of what do I do from a technology standpoint, an infection prevention protocol standpoint. I've got to get my acting gear pretty quick. And this is outside of just mandates and regulations, but just, how am I addressing my current situation in all vertical markets? So it's interesting to see the wealth of product that Seal Shield offers, from the keyboards, the mice, up to the UVC light box that's specifically called Electroclave. So there's really, it's an awesome catalog addressing an increasingly popular need. So if it wasn't important last year, it's definitely going to be something substantial for healthcare providers and also just other key vertical decision makers to consider.
Yeah,
and on that front, Matt, real quick, when you think about it, this isn't a short play, right? It's not like infection prevention is going to be just the short-term thing that's on people's mind. I think everybody now has come to the realization that this is actually a long play. And for our resellers, many of them, yes, in healthcare, but even outside in the retail hospitality, this is a long play. And so having, technology, the kind of solutions that we'll talk about here today in their repertoire, really necessary, I think, moving forward, so that they can be, again, that solution provider that we always talk about. But go ahead, John.
Yeah, definitely. That's a great segue into our main conversation here, which is all about the world of infection prevention technology. And I kind of want to lead off of what we were just saying there. And Robyn, it was a great way you put it there, this idea of the 14-year overnight success that Seal Shield became. I'm sure there was no desire to become, popular, if you will, in this way. This is the least useful way that you'd want to become a needed and a useful technology that people really talked about. But at the same time, it's great to know that it's not something that just like you had to just figure out overnight. It's something you were already working on and were ready to go when this happened. So tell us a little bit about, how your world has changed over the last year. What's been happening? What kind of questions have you been getting? What have people been bringing to you? And, and how does that work with what's happening in hospitals and healthcare right now in particular?
Yeah, no, that's a great question because, I joke about the 14-year overnight success story. We had great brand recognition and great depth in healthcare. We've been working at this for a long time, and we've seen infection control evolve in our health systems over those 14 years. It was not always as important as it is today. There is an infection control department and leaders and physicians in almost every hospital that specialize in that space. So yeah, healthcare has always been there. There's always been room for the spend. But what I really think has changed in the past year in our business, obviously our business had a great year last year, and it's unfortunate that it had to happen this way. But I think the positive results in how our business has changed is that our world is forever different. And Dean, you mentioned something to this effect a few minutes ago. And how our business is going to be moving forward is that infection control or infection prevention, we use them interchangeably a lot. It's part of everyday life now. So disinfecting, the difference between cleaning and disinfecting, and knowing how to truly eradicate germs in your home, in your stores, in your hospitals, it's forever changed. And I look at it a little bit like 9/11, and it was a tragedy, and it took something so earth-shattering and jarring and terrible to make us safer. So the way we travel is safer now than it ever was pre 9/11. I think we will forever be safer in the way we handle germ mitigation and just our environment forever forward. You know, every different vertical has looked at healthcare to adopt best practice, and since they're doing that, they're making us all safer in the long run.
Yeah, I can't imagine that anybody wants to go back to the way things were at this point. Psychologically, you can't just take that step back and say, "Oh, I'm fine with just putting my hands over all the things again where everyone else has been." Like, no, we're not going to do that. And granted, you know, Dean and I joke about this sometimes. I'm not a hardcore germaphobe, but I am someone who is very conscious about that stuff to begin with. I am that person that, you know, after I went to the grocery store, I was sanitizing my hands long before COVID was a thing. You know, I always wanted to be cautious about that. So, but that brings up kind of an interesting point when we talk about this idea of hospitals and healthcare and their place in this infection control dynamic, and obviously that it's more critical there than anywhere. There's a couple quick statistics that I found that I wanted to throw out here. So one's from the CDC, which says that approximately 1 in 31 hospital patients contract a healthcare-associated infection, which is an awful statistic when you really think about it. 25% of hospital keyboards harbor MRSA, and keyboards can harbor up to 400 times more bacteria than toilet seats. I feel like we always talk about that kind of stuff with phones, but man, our keyboards are pretty gross too. And granted, most of us in our day-to-day lives, our keyboards, we're just using them for ourselves and not really sharing them. But in a healthcare environment, super important that other people aren't touching them. And, you know, and it's bad enough that I know that my germs are all over something. I don't want someone else's germs to be on there when I'm touching it myself too. So Matt, I kind of want to throw this one to you next to talk a little bit about this idea of what hospitals and healthcare, you know, are dealing with, that this kind of stuff can be a huge liability for them. You know, if someone comes to the hospital for a routine, you know, surgery or something routine that they're there for and picks up an infection that was given to them by a healthcare provider or something that was spread around the hospital, that's got to open up the world of liability to them a little bit. So what's your experience with that and dealing maybe with some of our VAR friends that are trying to get out there and talk about these things? And, you know, do you talk about these kind of statistics and ask them, like, what are you doing to help with infection control?
Yeah, exactly. So it just, at least in my personal experience, and just trying to navigate opportunity and trying to figure out what are the pain points, what are some of the mandates that may be driving this, just from the backwards and up, was the idea is reducing readmission rates. And so it's the idea, like you had said, if a patient goes in for a routine procedure, the last thing you want to do, of course, is just simply acquire an infection, which is another conversation from a patient experience, you know, and that's another topic, or reducing potential patient satisfaction scores for a hospital, but really just trying to minimize the readmission rate for a patient that is discharged, come to find out they acquired the infection. Now they're having to be readmitted to the hospital, which is affecting the staff again, putting additional draining of some of the resources on the staff. And this is outside of COVID. This is just, you know, let's just pretend this is a normal situation. You're just trying to minimize a return of inpatient readmission. So there's scores based on this of trying to maintain within the acceptable threshold, such that you're not having just high admission rates. So what we'll come to find out is hospitals start getting onto an unfortunate list where you've now incurred high rates of infection, high rates of admission. With that comes really, it's really hitting the bottom line, and that's really the pain point that's driving this, because the hospital will be fined either a reduction in payments or a delay in payments. So this is something they don't want to do. So really the question that, you know, I guess you could say value to the VAR, or, you know, what would I do with this information that I know, is approaching a hospital from that angle of what are you faced with? You may already know. There's reports that we can see and we can run ourselves that'll indicate specifically which hospitals have high rates of infection. So at least you could probably target those for opportunity. But the idea is, what is your infection protocol? What types of measures are you taking? What's the accountability of the workflow in this? Just looking around, what kind of equipment and technology do you have installed? Are you using medical grade barcode scanners, medical touchscreens, keyboards, mice, antimicrobial screen protectors? Are they even applied, et cetera? So just doing a quick checklist of what does this hospital have, for example, in what areas, and then, okay, where can I fill in the gaps? They're probably not using these washable keyboards. It looks like I don't see the mice. There's a lot of screens around here that could be waiting to have an antimicrobial screen applied. So there's opportunity there. And then the next question follows on, and it just goes on and on, of course, of What is your mobile strategy? Do they have a wealth of mobile devices? Let's just say Android rugged devices, for example, installed in the hospital for clinical staff for optimizing patient care and clinical communications, and then even tablets, for example. That's great. Okay, then the next question, of course, is how are you cleaning and disinfecting these? And hopefully they are. Hopefully there's a protocol written around that. And then this is when you can start, as a VAR, can start suggesting, obviously, solutions around this. Did you know that certain vendors like Seal Shield have these particular products? Did you know that there's a way to easily and effectively and quickly and clean these particular devices and have mobile device management capabilities and access control around this as well, so that the solutions build and build as you go, really completing that complete picture for an overall infection prevention strategy.
And you know what, Matt, just to kind of parlay on that, and as you were talking about, of course, healthcare is an environment where that makes a lot of sense. But I would argue also that you can, and to where we were just a couple minutes ago, our whole world has changed, right, Robyn, in the sense that it's not just healthcare where this sensitivity is now coming into the workplace. It's everywhere. And so exactly what you were just saying, Matt, I think you can parlay that into a number of industries. I mean, think about hospitality and retail. Yes, some of those point of sale systems still have keyboards and mouses that are being used, by shifts of people that, while there may not be a legal liability for the retail establishment as far as infections concerned, there's still a liability in that if that device now spreads germs amongst their employees, well, their liability is that they're not going to be working. They're not going to, they might be out sick and stuff like that. Think about warehouses that use the ruggedized tablets that you were just mentioning, or the mobile devices. If they don't have screen protection on it that has antimicrobial, now there's just a new reality, I think, that many people are coming to about all these touch points. And it's not that maybe there's a phobia around it, I like John sometimes has, but anyway, maybe it's a little bit more to we're educated now, and we have these types of solutions where you can mitigate some of the risk, if you will, of having people out due to sickness and illness that may be caused by these devices or the fact that they're not protected, right?
Dean, that's if you don't mind, I'd love to make a comment on that. That's absolutely true. And so when you talk about it in healthcare, hospital-acquired infections are a $45 billion a year cost for hospitals in the U.S. That's what it's costing, and they're not getting reimbursed by Medicare, Medicaid. They're not getting reimbursed by the private insurance companies because it's the hospital's fault. It was acquired in the hospital by no fault of the patient or nothing that happened outside of the organization. But at the same time, there's that dollar sign that everybody's got to worry about, but it's also human lives, right? These hospital-acquired infections are often deadly, and the numbers are staggering. Like it would make anybody fear going in to have, their appendix out. And then when you look at other industries, we're not necessarily talking about it in such a severe way in terms of reimbursement through insurance policies and whatnot, and we're not talking about the level of fatalities from it, but we are talking about welcoming your employees and your customers into a safe space where they feel that your brand is taking care of them by having infection control products. So I have to go to Target. I have to go in sometimes. I've got 2 kids. Can't live without it, But they have these payment devices that I can tap my phone to it and say, here, I paid. But then they won't touch the screen. Yeah. and everybody else has touched that screen. And you know what? They can't clean that screen because if you take bleach or isopropyl alcohol or any sort of heavy disinfectant to that that device, that payment device, you're going to ruin the screen. It's going to fog. It's going to become null and void, and then you have to buy a new one, which is great maybe for your partners, but you also want to protect their budgets so that they stay on cycle and keep purchasing with you, right? So screen protector makes it so that you could have that, real good wet dwell time, and you protect your workforce and your customers. And that's really what it comes down to. Nothing we do is worth the dollars if we're not making a difference.
Man, Robyn, you hit the nail on the head there with this idea. I went to Walgreens a couple weeks back, and they've got where I can do my Apple Pay now, and that's great. I even I'll use my watch, so I don't even have to worry about the mask thing. But I do it, and then I still have to type in my loyalty number. I've got to touch the screen to say no, I don't want this, or yes, send me that. What was the point of this? It wasn't. It suddenly stopped being contactless. You're dead on. There's still. I think that's the one thing that people are still going to have to figure out is we may come up with all these great contactless options, but unfortunately, there's still so many ways that we're touching things that we just don't think about. That actually brings up and we've kind of started talking a little bit about, some of the other industries where this can come in handy. There was a great quote that I found on fiercehealthcare.com where they interviewed Rebecca Bartles, who's the infection prevention specialist for Providence Health. And she said, I'm also struck by, prior to COVID, infection prevention was my job, and now it's literally a part of what every member of every team does every day. It's now integrated into conversations and galvanized in a way that it wasn't prior to COVID. And in public, in places like restaurants and grocery stores, there is a greater appreciation for how diseases spread. So as we think about that and realize, yes, this is beyond a healthcare thing. Obviously, in healthcare, it's critically important in so many ways because you have people that are potentially their most vulnerable to getting an infection in a place you don't want them to. But outside of that world, when we start thinking about high-touch services and devices, I worry about the devices we carry around in our hand every day. We always have this device that we're putting to our face, we're touching with our fingers all day long. We're setting it on surfaces that are probably, filled with potential germs and transmitting them back to ourselves. So, what does that mean from your perspective? Are personal devices part of the problem? What do we need to be thinking about? Because I'm sure this goes beyond what you guys even do. There's just a larger world here to be concerned about now.
No, it's exactly what we do. Personal devices, you can talk about personal devices in healthcare and outside of healthcare. You can talk about personal devices in your home. You used a statistic at the beginning of this podcast that we always use, I always call it my scary facts slide, where I'm giving a presentation, but you said that computer keyboards are 400 times dirtier than a toilet seat. Well, that's actually the statistic that came from Dr. Gerba out of the University of Arizona, that we really say help drive the initial years of our business. So nobody was taking infection control seriously, and everybody had a cell phone, but nobody even thought about it at that point that your cell phone was dirty. And nobody even considered that their keyboard was dirty, but it is. And our phones started ringing. All the people who are like, yeah, we don't need that kind of product, all of a sudden started ringing. So now, 14 years later, these are very different, right? They are not the same devices that they were 14 years ago. We live and die by them. Seriously, can't be without it. Cannot be without it. And I know most people take these all places. And if you say you don't, I'm going to think that you're maybe not telling the truth.
Yep.
So when you're not disinfecting those, doesn't matter if you're washing your hands or not. Whatever was on your phone is now on your very clean hands. So hand hygiene is not enough in healthcare, in your home, in the workspace. Hand hygiene is not enough because your devices are contaminated with serious pathogens. Your surfaces, your touch screens, your computer keyboards. I'm sitting in a hotel room right now, which is a rarity these days for most of us, right? You know what the dirtiest thing in your hotel room is?
Remote control, isn't it?
Someone want to take that? Remote control.
Yep.
Remote control. It's touched multiple times. We got to think about those things to protect ourselves, our families, and our communities.
Let's talk a little bit about that, and maybe we can kind of shift a little bit to some of the technology, because I know at Seal Shield you guys have UVC cabinets or where you can put devices in, and it's more than just the screen protection, right? It's also disinfecting, and I don't know, this is where I need some education from you, the devices themselves. And I think that this is important to realize that these types of solutions are out there, because again, I think of a lot of our resellers may not be aware of the fact that, yeah, we have these cabinets available where you can put devices in them, right, for overnight or whatever, and they come out disinfected. So help us understand that UVC technology and what it looks like in some of those component cabinets that you guys have.
Yeah, no, I'd love to talk about it. I am incredibly passionate about our electroclave solution. UV is probably something that people have become really familiar with this year, your average non-healthcare employee. But a lot of us think about UV as a one and only. UV is UV. Well, that's not true. Not all UV is created equal, and not all UV is effective for the same spaces. So our electroclave solution is actually UVC LED light. And why is that important? We're putting our devices in there, and we are able to disinfect them at zero heat. So we're using the most efficacious, shortest wave part of the wavelength to get incredible efficacy and results. We need to think about UV in a way that you think about light bouncing off a surface. Well, that can cause shadows if not done well. And if you're causing a shadow on your device as you're disinfecting it, you are not disinfecting the entirety of the device. So what we've been able to do in our electroclave solution is actually get full 360-degree disinfection of the device in the cabinet. So you can have up to 12 devices in the cabinet, depending on what device it is. Anything from a Zebra handheld computer to a smartphone, or a Vocera badge, or handcuffs. We have them everywhere now. We have them in casinos and police departments. You wouldn't believe the use cases now. So we're disinfecting, and that solves one problem. The other problem we're solving is that, and you need to drive compliance. Most folks, so if I'm going to go back to healthcare, most healthcare systems do not have a great way to enforce the disinfection of devices. So you have an infection control leader saying you need to clean that device 5 times a shift, right? Well, how do you know it's being done? And there was a study recently in Infection Control Today that said 3% out of 100 nurses, floor nurses that were polled in a hospital, 3% said they were trained on how to properly disinfect a device. So what we're doing with the electroclave is we have a cloud-based software component where we're actually tracking all the disinfection process, the cycle by device, by user. We can really hone it into what the facility needs. But now we're providing data and accountability. And you know that the devices are now being disinfected. So we put a policy in place, and then you get the reports. The reports come to you, and you say, oh, look, we did really good with this unit in the hospital on infecting devices, but unit B really needs some work, and we need to go do an in-service and give them a 15-minute training on how to disinfect their devices and show them, where they can be better, where they can be safer. So that's really the big picture around the electroclave, and we have some really cool stuff we do in there that no one else is doing. We're just taking all the risk out of UV, and there's a lot of risk when it comes to UV if it's done poorly. And man, there are a lot of poor solutions on the market today, and we have some brilliant guys working for us who built this solution, and we're just so proud of it. And it's being utilized at the CDC in their lab. They're actually standardized on our electroclave solution. We have some great customers, and just been very, very fun to watch the world appreciate the great technology.
It is. And again, the reason I think it's important to dive into it here, I think it's just one of those technologies that maybe people have heard about, but don't understand that the solutions are there and they can be applicable to where you were earlier. Lots of different use cases for using, the cave. And you got to see one of these things. I mean, they're like, right, they look like a cabinet, but you can put your devices in them. How long does it take, real quick, Robyn? I mean, like, how long, if your device does it need to be in there for 15 minutes, 10 hours? I honestly don't know. I mean, what's the average?
No. So without getting into details of efficacy, we can get a 3-log reduction on pathogens, 99.9%. That's the kill claim that we can make in 60 seconds for up to 12 devices. So
Wow.
you can fill that baby up and get it all done in 60 seconds. And we have EPA approved claims on pathogens, like the scariest pathogens we talk about on a regular basis that are really hard to kill: MRSA, C. diff, CRE, VRE. We actually have EPA approved disinfection claims, which is not something that anybody would have ever cared about before COVID, and now they do. And it's important to have that governing body validation.
Well, I'm going to give you an idea, and I think John would like this idea too. You should develop a plane that can just fly over everything and hit it with UVC light. We'll all shelter in place while that thing is going overhead, right, John? And then
I'm sold,
just killing. There you go.
Works for me.
You know what?
I'm all for it.
Sounds like you just gave us a reason to get a company jet.
There you go. It's for research, R&D,
There you go. Matt, what are your comments on UVC? Because I know that you were talking about that in some previous podcasts that we've had before, and it's powerful and what it can do, but the use cases in healthcare are obvious as well, right?
Yeah, Dean, no doubt. And so it's really just about, like Robyn had said, to her point, was just there's a lot of different devices out there that are, the phone slate or I think what it might be called of just, that's on a lower grade of trying to clean a device. Some of these other things that are just popping up like crazy, but really just, more so, you've got to look at an enterprise capability, just like we tout of using a rugged mobile computer versus a consumer device. You really shouldn't utilize anything that probably is more suited for a consumer use when it comes to infection control. Again, you're talking about a protocol here, a mandate. Within hospitals, it's even more paramount because you're talking about infections and patients and just other assorted issues. But it's expanding to all different markets, and that's what's I think exciting about this is, I know we focus and discuss. It's easy to stay within the realm of hospitals, no doubt. But just last year and this year, we'll continue the shift of adopting more of these technologies to a greater magnitude as we move along. But it'll become part of the new normal. I've got a new normal bucket. I'm sure, like we all do, of just you just keep dropping new technologies in there because guess what? That's where we are now. It is what it is.
Yeah,
absolutely.
Definitely.
And if I was a reseller, that was in ADC, back of house, maybe warehouses, what you were saying earlier, Robyn, it's about making your customers feel safe, sure, or your employees feel safe. So what's preventing them from walking in there with a solution, UVC, cave solution for all those devices that are being used back of house for tracking and stuff like that? I mean, you can really make a difference there. And thank you for educating me within a couple minutes, and I love the fact that you already have cloud-based automation to that, that can report, how long the device has been away. And of course, that's smart technology. That's exactly where we're going to be going with these types of devices. So lots of opportunity there. I'm sorry, John. Go ahead.
No, it's fine. I mean, I think bottom line is that is where we're kind of going with the future. I kind of had a question about the future, and I feel like we've already more or less kind of touched on that. So I actually want to maybe shift us over to our value to the VAR, because I think that's going to kind of fill in the rest of our questions. Before we do that, though, I want to, as always, thank our sponsors, our TEConnect sponsors. That is Elo, Epson, Honeywell, and of course Zebra. We appreciate your support on the show. We would not be able to do this without you. Listen, if you have any thoughts or input on what we've talked about today, have any maybe questions of your own, a few things you can do. One, go to Apple Podcasts, leave us a 5-star rating and review. The last review I saw on there was from one of Dean's kids, I think. We need other reviews besides that. We know they think Dean's fantastic, but I want to hear from our actual listeners and viewers. So go drop us a line, leave a comment. We might read some of them on the air. We'd love to hear from you. You can obviously also reach out to us on our Twitter feed. You can read us. That's at TEConnect Pod. You can also email us TEConnect@BlueStarInc.com. All right, as mentioned, well, as always, we want to wrap up our show with our 2 recurring segments. First up, value to the VAR. So my question here kind of does really wrap up a lot of this conversation, which is, and Matt, I'll kind of let you kick this one off. I think by now we've got a lot of our VARs customers, especially in the world of healthcare and maybe in other places too, maybe also even really especially in those other places that don't think about this quite as much, but maybe started to a bit more. They also at this point might feel like, hey, we've figured it out. We get it. We're doing more stuff that's contactless. We put some kind of little safety thing up. We stuck up a random shield, some kind of, piece of glass or whatever. Like, we've got it figured out, right? So we know that's not necessarily enough. And solutions like what Steel Shield offers are what's going to take you that a little bit, that extra step. So when our VARs are approaching their customers and having these conversations, what do you think they should be talking about? Or what kind of questions should they be asking? What kind of maybe facts and figures should they be putting out there to help them understand? Maybe you don't have this figured out entirely and there's more you could be doing, and here's what I'm recommending.
Yeah, exactly. And I think the situation may fall more so from a customer experience, patient experience, and also enabling some of the workflows that come into play, just based on where is it okay for touch technology to come into play, and maybe where it's not. And this has obviously forced partners and end users to adjust their business plans, as I'm sure you're going to hear shortly for this year. 2021 is going to be very different for a lot of partners and end users of what they're going to look at and what they're going to focus on and invest in. So, should I continue with the trend that was, think of a kiosk, for example. I think we're still going to stay there. It may just be utilized in a different scenario. And so now, for example, let's just focus on that real quick, of just utilizing that certain technology, of the ease and experience with a touch kiosk is now going to be critical in the front. You're going to minimize having that initial interaction in a hospital, school, warehouse, place of business, because now you're seeing the proliferation of touchscreen with facial recognition, temp screen, et cetera, that is now basically the new access control that we're calling it. And then, of course, well, that's great and all, but now you're utilizing a touch device everywhere, and we're trying to minimize touching. So it's almost like a catch-22. So, now there's the opportunity again of antimicrobial screen protectors and things that are going to be applied there to reduce that. I've got to touch this device, for example. But I think some of the from a VAR standpoint is like, hey, this all sounds great to me. I feel like I'm educated in this hour segment. I'm already selling into some hospitals. What the heck do I do next? And I think, at least in my personal experience in selling to hospitals, was the infection prevention director could be your friend and your champion immediately. Some of these folks are easier to get into. Hospitals are hard to sell into, no doubt. Trying to get to the director of nursing, director of IT, director of IS, for example, get those folks on board with you. Pull in purchasing if you need to. Obviously, you want them on your side in the decision-making process. But then what I found was infection prevention was a little bit easier path to get into the hospital. You've got them on your side. You're now in, and now they may not be the key decision maker, but they're a key influencer, and they're part of that decision-making process. And now you've got them on board. And then secondly, again, like we touched on earlier, just with the comment of, if infection prevention wasn't a critical concern before, it will now. Folks are demanding these products and solutions. And now you can come armed with this information and the assortment of technology that's really out there addressing some of those needs. So I think the path is a little bit easier to start selling some of those solutions in those certain areas.
Yeah, I think you made a great point there about, honestly, before I started researching this, I didn't even know that an infection prevention person existed. It just didn't occur to me. Like, it's one of those things that makes complete sense, regardless of our current situation, that there be somebody in healthcare and in hospitals whose job it is to make sure that this is not something that's occurring. But yeah, it's not someone I would have thought of before. And obviously, it's the perfect kind of person to get that entryway and that gateway into talking to some decision makers, where you've got a champion that walks in with you. So, Robyn, why don't you elaborate on that a little bit about, where do you see opportunities for resellers to really make their mark and push for this discussion beyond the world of COVID? They might be thinking to themselves, well, we're going to get vaccinated. We're going to be, quote unquote, out of this at some point soon? Do we really need to be pushing that hard, especially in other industries? What would you say to them?
Yeah, I'll touch on Matt's comment first, because they're saying, what am I going to say to an infection control director? I don't know infection control. That's not one solid tip. You get an infection control person and an IT guy in the same room, and you say, oh, we just sold you all these Zebra devices. How are you disinfecting them? And the IT guy says, oh yeah, they clean them, they wipe them down. And you say, no. How are they disinfecting them? Because cleaning and disinfecting are not the same thing, and it is important to differentiate and to offer the disinfecting solution. So, that's the easiest way to walk in there. And so real quick, think of cleaning as dislodging a pathogen, right? Like moving it around. So you're going to get some of them off there. It's going to be good for some of them, but you're really just pushing them around. Disinfecting is actually eradicating the pathogen, killing the pathogen on the surface, right? So knowing the difference between that just automatically gives you a smart way to talk to the two people at one time. Because if you say you say disinfecting to the IT guy, they're going to say, no, you can't put the cleaners on that device. Do not put Cavicide on that device. You will ruin it. We don't have budget for more. Don't do it. And so that's the thing. The CDC calls for a 5-to-1 cleaning to disinfection ratio on those handheld devices. Now, you got to have the way to do it without putting harsh abrasive chemicals all over your mobile device, or being able to put harsh abrasive chemicals on your screen. So your touch screens, your kiosks, the things that won't fit into the electroclave, right? So there we have our screen protectors. You can hit them with all those wet dwell times, with all those abrasive cleaners, and they're offering the solution to everybody, right? They're answering the IT guy's problems and the infection control person's problems. And then we take it to that other level with the electroclave and the compliance piece, the data. So you're really going in there as a hero. What I'd also say to your resellers when they're in there is get my sales guys on the phone. They're great at talking. They know our products all day long. So if I can get my sales team on the phone with their customers, they'll be happy as a clam because they'll make some money that day.
That's what they want to hear.
That's right. And as we talked about earlier, again, I think resellers have to have in mind that this is a long play. I was watching, another one of those mini series or a documentary about COVID-19, and they had a lot of, experts come on, and they reminded me of something. I think the world is thinks of COVID-19 as once we get over this hurdle of COVID-19, whether it's this year, whether it's next year, at some point in time, this will come to an end. But then they reminded me, you know what? There's just the next infection down the road, unfortunately. I mean, I don't know that it'll be a pandemic, but there will be other infections, SARS and stuff like that. I mean, they happen all the time. So what I mean by a long play, if nothing else, resellers, again, they just need to become knowledgeable about the solutions around disinfecting products that they're implementing or technology that they're helping to implement. It's just a smart way to yet have another thing in their holster of ways that they can further elaborate on a solution that's going to be a long play for them as well. Again, disinfected in this new reality that we've all come to as it relates to pathogens. You now have a solution that you can offer up to it. I think that's the value to the VAR here, at least in my mind.
You're right.
That they have solutions, they can walk into that place, and it's going to be a long play. It's going to be around here forever. For the rest, viruses have been around forever as well, right? So, it'll be.
Consider this. What if we keep our really good infection prevention strategies that we've implemented this last year in all these retail spaces and schools? What if we keep up with it? Do we permanently lower flu rates?
Yep.
Do we not have to worry so much about, really pesky, not necessarily deadly, but the pesky colds that go around and around and around, and basically, if someone 10 feet away from you has a cold and you saw one, so eventually you're going to get that same cold. What if we keep all these measures in place and we just become better as a society? in terms of protecting each other.
Yeah.
And that's where we see it go.
Yeah. You know, I think the bottom line here is we're all too savvy to go back to pretending like this isn't something we're concerned about anymore. We've all learned this lesson over the last year. And I think that is a great starting point. You know, this is great answers all around, but I think that's a great starting point also, is just to go in and say, hey, you know, this isn't something people are just going to forget about. They're not just going to assume everything clean again as soon as this is over with. As Dean put it, there's always something around the corner. And Robyn, as you just mentioned, this kind of stuff can only help prevent other types of the common flus and colds and things that are always spreading around anyway as well. So great answers all around. Well, let's shift to our final segment, which is our favorite part of each week. What's TEConnecting with you? This is where we go around the horn and just, you know, talk about maybe some cool piece of technology, a gadget, something from the world of science or innovation that's caught our attention recently. We want to talk a little bit more about. Robyn, I'll let you start. What's TEConnecting with you?
Oh gosh. My outside of my tech work world, I feel like my tech is very toddler focused. But
I can relate.
You said I could talk about an app, so I'm going to. I found this really cool app this week that I can't wait to show to my 3-year-old. It's called Skygazer, and he's very into space right now. So we can essentially download that app and take a picture of the night sky anywhere we are, and then it digs deeper into it and tells you what stars you're looking at. It tells you like all the things you can't see that are above you, and it gives it to you in real time, real day. It's exactly what's happening in outer space above you, which I think is going to be like blow his mind, because it blows my mind. And then there was an app I saw recently. A friend of mine was working on it, and it's called Conspire. And what they're doing is super cool, because in COVID, kids have really suffered by not being able to go to their physical therapy appointments and occupational therapy appointments and speech. And so they're building a platform to drive the activity at home, and that the therapist can actually go into the app and see how they've done on their activities, a quick snip with your phone, and they can evaluate it and put. It's basically communication for physical therapists and families to keep progressing when they can't really do the best hands-on therapy these days. So
I like that.
2 very cool things that I think are, one's really fun, but one seems to be a game changer to me.
Definitely.
No, I like that. I like how people adapt technology, as you were on the therapist. And by the way, that Skygazer is awesome. We use it outside too. We go outside and look for the space station. There's my tip for you. You know, it might be below you, might be somewhere, but always, you know, it tracks the space station too, which is really kind of cool.
That's awesome.
That's awesome.
All right, Matt, what about you? What's TEConnecting with you right now?
Well, I think that's Dean's idea is fantastic. This UV plane, you know, it's just awesome. Let's try to make it happen. But I guess it's hard to, find one piece of technology. But like in thinking hard about it, just from my chair where I sit, just being around a lot of different technologies and things like that, is just what is flying at us just based on what's happening out there from a global pandemic standpoint, from a technology standpoint. Last year, your remote testing sites and temperature screening kiosks were never in anybody's vernacular. You know, it sure didn't really hit many people's radars, probably underlying and kind of quiet, but more so just how everybody's pivoted, adjusted. I guess more, you know, if you to answer the question, I guess you could say is what's interesting is just market adaptation, vertical market adaptation, not just, you know, really healthcare, of course, but just how end users, partners, have really said, whoa, you know, there's a lot of different things coming at us. How are we going to change and adjust? And you're just seeing some different technologies that have presented themselves in very, you know, interesting, different, odd ways that you didn't before. And then coming to grips with that, and then figuring out, is it going to stay? Is it the new norm? And can it be repurposed, et cetera? So, you know, things like the facial recognition, temperature screen that were probably there underlying, that are now very forefront. And I think it's exciting that, you know, just to see it develop and grow and be part of this year's business plans.
Very cool.
And the light speed at which some of these things are being adopted, to your point, right? And being implemented and improved upon. It's unbelievable how some of the technologies advance.
And this has all been within 10 months, essentially, that all this is happening and being vetted and approved and in place, and opportunity and sales are actually occurring and being installed. It's fantastic.
Just like that. Yeah, yeah. Well, I'll spare you for my what's tech connecting with me, John. I'll spare you of my recent drone. Although I saw another article about how now they have these little micro drones and I know I'm going to feed right into your hysteria, but they provided to the UK military the little itty bitty things that can swarm, and they're starting to use them in a military sense.
Oh, great!
I'll spare you the drone. But here's my tech connector. What's tech connecting with me? I was reading an article on the Seal Shield website in preparation to this, and bet you didn't know this, but did you realize you, my friend, are half virus?
Oh, I didn't know that.
You're half a virus.
Great,
yes,
I'm the
apparently.
problem. Thanks a lot.
Yes, well, we all are. I mean, we are. The human genome, I guess, is half virus. Somewhere way back in our ancestry, viruses injected themselves in our eggs and sperm, way back when. And when you look at the genetic makeup, we humans are half virus. We share the same. So there you go. So
well,
you're a part of the problem, John.
No wonder we're destroying the Earth. We are this awful plague and bug on our own planet. There you go. That explains a lot.
There you go. Yeah.
All right.
Right. Yeah.
Okay.
Don't worry, John. The other half of you is part of the solution.
Oh, good. Okay.
There you
Well,
go.
that works nicely. It's a nice balance there. I can appreciate that. But that's why I always feel like I'm at war with myself. That was a bad joke. Anyway, so my tech connecting this week, Dean, you might remember from an episode last year, we talked a little bit about autonomous vehicles, and I kind of reiterated a little bit of a podcast that I'd actually read the transcript of that talked about that, we're not as close as we'd like to be to just having automated vehicles just roaming around the streets and self-driving cars that we're all taking care of. Well, to add on to that a little bit, I came across an article from Texas A&M University where some of their researchers started looking beyond not just how do we get the vehicles themselves on the road and safe and able to handle, the twists and turns of driving and manage what they can see and can't see and when you need to stop, traffic signals, all of that, but started paying attention to the health factors that might be related to autonomous vehicles. So they came up with 32 potential health factors that could be impacted by these vehicles being on the road. And a couple of the ones that really stood out to me is one, riskier behaviors. People thinking like, hey, I'm in a self-driving car. I don't need to wear a seatbelt anymore. I don't need to pay attention to what's going on around me. And granted, if it's a true self-driving vehicle, maybe you don't need to, but we also know that a lot of these early models are going to be ones where you're still expected to be there with your hands on the wheel, ready to jump in if you need to. I think we're still a long way off from just complete automation. So, there's some potential risky behavior that could be involved. More air pollution. Granted, I think a lot of the companies that are doing this are looking to make them electric vehicles, but if they're not, if you've got so many more people that suddenly start driving a self-driving vehicle that may have otherwise taken public transportation and reduced the amount of, pollution created in that way, now suddenly if, 20 people that normally would ride a bus are driving 20 separate vehicles, that's potentially creating more pollution.
Got it.
Didn't really think about that before, but it makes sense. And then also the loss of driving jobs. People whose living it is to drive people around or drive a bus or a taxi or an Uber. If there's a self-driving vehicle that can do that for people now and they don't need to employ someone doing that, potentially you're creating some health risks, if you want to think of it that way, of people losing their jobs. So just
and the big
more
one
of
there
the,
is Yeah, the big one there is truck drivers. I always think about that because, as we were talking about before, fully autonomous trucks was like one of the key places that they were going to start this technology. And you think about all those people that make a living driving trucks around. It's it'll be interesting to see how that pans itself out. If you listen to Elon, I mean, he's like it seems like he's just days away from, I think they call it level 5, where it's like fully autonomous type of a vehicle. I'm saying days, but I'm kidding. I mean, I think that he's maybe months or years away from it. I don't
comparative
know.
to we were before. Yeah.
That's right. That's
Definitely.
right.
Yeah. So that was some interesting, insight. And this is one of those things I know we're all excited to get our self-driving car. I would love nothing better than to be able to watch a movie or read a book when I'm out headed somewhere. Not that we go anywhere anymore at this point right now, but someday when we do again. But there's a lot of stuff still to consider. I think we're quite a ways off from this, and there's a lot of factors that we probably haven't even thought of yet that might come into play.
Yeah.
So
True.
All right. Well,
Well, Dean, I do think we've all probably spent a few extra minutes in our cars during this quarantine time we've all escaped our cars a little bit, right? Everyone's done at least one.
Yeah, sometimes you pull into that
Yes.
garage and you're just like, I don't want to go back in there for a while. I'm just going to hang out here and listen to this. Let this song finish. Let this
Exactly,
podcast
right.
finish. Yep, definitely.
Right.
Well, that is what's TEConnecting with us this week. I want to thank Robyn Ewers and Matt Jordan. Thank you so much for being on the show. If you want to learn more about Seal Shield, go to sealshield.com. That is SEALSHIELD.com. I will put a link in the show notes too. We appreciate you being on here and talking about this topic, but that does it for us today. So until next time, stay connected. Providing the right care to the right patient at the right time is crucial. By connecting patient data, clinicians, and providers in real time using Zebra's healthcare technology solutions, providers can consistently deliver a higher level of care with fewer medical errors. With Zebra's purpose-built solutions, you can easily ensure access to the critical patient data through seamless integration and device management. The strength of the Zebra healthcare portfolio helps maximize clinical operational efficiency and patient safety in critical areas like positive patient identification, clinical mobility and collaboration, and with supply chain and inventory management activities. Looking to improve accuracy, clinical staff productivity, and patient safety? Go with Zebra Healthcare. By now, you probably know that adding touchscreens at check-in and throughout the care journey has a big impact on patient experience in healthcare, but what about the providers themselves? Give them the technology they need with ELO O3 Series medical-grade touchscreen monitors. Merging ELO's best-in-class touchscreen technology with DICOM 14 functionality enhances clinical review, improves workflows, and eliminates common keyboarding and point-click errors. Compact, clean designs make these monitors perfect for EMR documentation, image viewing, clinical collaboration, lab and pharmacy work, and much more. To learn more about these built-to-last monitors, check out the link in the show notes or contact the BlueStar ELO team.